In this lesson, I will explain the pieces to the newborn body system assessments and your role for doing these. All right, so our screening, what is this all about? So there's a few special assessments that are going to be done while the baby's in the hospital. So the first being, any of these assessments are done, the baby must be kept warm while these are being done, okay? So really important. You as a nurse are going to either perform these screens or help facilitate the screening, just depending on the hospital and their protocol. So the hearing exam, this one is done, a hearing screen done to assess the baby's hearing. You can see this image over here. The electrodes are placed on, with the machine, placed on the head, placed on the ears, and noises are made, and they watch the brain activity to see if the brain is responding, therefore the baby being able to hear. Now, some babies are going to fail this, and it's okay. They'll just be rescreened. A lot of times there's still fluid in the ears just from birth that hasn't cleared out. So they just need a rescreen once that fluid's kind of cleared out of their ears. There's also going to be metabolic screening. It's also known as newborn screening. And this is done on all babies. This screening used to be called PKU, if you've heard of that. That's one of the things that the screen tests for. So it tests for metabolic disorders. PKU is one of the big ones that it tested for. So it used to be called the PKU test, but now it tests for about 26-ish metabolic disorders. It's sent off to the state lab, and then the results are read, and the follow-up doctor, whoever that pediatrician is, will get those results. So it usually takes like 2 to 4 weeks for that, the physician office to receive it from the state lab. So the main one being PKU, there's maple syrup urine disease. It tests for cystic fibrosis, galactosemia. There's just so many more, but any metabolic screening it's going to check for. The baby is also going to have a bilirubin level drawn to assess for jaundice. So jaundice is that yellow color that babies can get when the bilirubin's high. So the bilirubin is going to build up. When it builds up, it's broken down red blood cells. So if the baby's had things like a lot of bruising at delivery, that's going to cause more broken down blood cells, right? So it's going to cause that bilirubin to be higher. The more the baby poops, the quicker it will come down because it's excreted in the stool. So this is going to be checked prior to discharge or sooner if there's other concerns that it's higher. The congenital heart screen. Now, this one is a relatively new screen that's being done, and the baby has to be 24 hours old for this, and we do a pre-ductal and a post-ductal oxygen level. So pre-ductal just means it's on the right hand, and then the post is any of the other extremities. So you just put one on the right hand and then one on a different extremity. And the pre is always the right hand because it's the blood prior to entering the heart, and post is the other extremity. So wherever you want to put that. The saturation should be over 94% for this. So the oxygen level over 94%, no more than a 3% difference between the two readings. So for example, a 95% and a 97 is okay because we are above 94 and we're only 2 apart. 100% and a 95% would not be okay. So yes, we're above the 94%, but we're greater than 3% apart. So this baby will either need a repeat done, retry it, or maybe a cardiac consult. So the congenital heart screen is 24 hours, and so is the metabolic screening. These two have to be 24 hours old. Okay, so let's look at these different systems and what we expect to assess and find if there is a concern. So first, the nervous system. We have been assessing the baby's temperature frequently in the beginning, usually that every 30 minutes for the first 2 hours of life, and then whatever the hospital policy is. Newborns have a limited ability to thermoregulate themselves, which can quickly put them into cold stress. So when they become cold, they are going to divert calories, they're going to burn up their blood sugar and increase their oxygen consumption. So this becomes a disaster. I once was caring for a preterm baby who was 30 hours old, needed a bath, and the temp had been stable. So I gave it a bath. Then an hour later, the mother called to tell me that she thought the baby felt cold. So I went in to check, and his temperature was 96.8. So I took him to the nursery and put him under the radiant warmer. His blood sugar, I had to check, and it was undetectable because it was so low. Now, our machines at our hospital, this means it's usually under 10. The nurses all jumped in to help. We started getting supplies because I knew I was going to have to give IV dextrose, just an IV bolus. And I called the doctor for the orders. Well, while I was on the phone, I hear one of the nurses called my name, and I could just tell by her voice. I turned, the baby was completely blue and apneic. So I dropped the phone, started giving PPV to the baby. He came around quickly. We got an IV in and bolused him with dextrose. He, of course, went to the NICU for monitoring. And a week later, it came out, we discovered that he was actually born diabetic, which is extremely rare. But all of this shows goes on with cold stress. You know, they're going to burn up their calories, use up their sugar, just trying to keep warm. So another important factor that you want to remember is that newborns cannot shiver. Okay, no shivering. We shiver to produce heat and keep warm, but they can't. They burn up their sugar and burn calories, burn fat off their body to warm up. So that's obviously going to create a problem because then we're going to have our low blood sugars. You will also see tremors in babies, and this is a normal thing that they can do, but sometimes that can mean hypoglycemia. So we just want to watch for that. The parents will see the tremors. They're going to think that the baby's cold. So remember, tremors can be normal, but it's never shivers. There's no shivering. We want to check reflexes, is also key for part of the nervous system assessment, and you can refer to the lesson on reflexes for more on that. The cardiac system is going to be checked for good heart sounds, right? We don't want to hear any murmurs, and check for them. Now, remember, murmurs are okay or normal in the first 24 hours, but after that, we would want to make sure we notify someone that there is still a murmur being heard. Our heart rate, 120 to 160, we should hear. Of course, if the baby's in a deep sleep or been screaming, it might be varied on that. And then we want to check for pulses, just equal pulses, strong and equal. And then our respiratory system. So good respiratory rate, 30 to 60. We'll observe the pattern, the effort. We want to make sure that it's non-labored breathing, just to identify any concerns that might be happening. Now on to a few more systems to cover. So the hepatic system. For this, we might be seeing signs of jaundice, that yellowing color of the skin. So we'll draw bilirubin level on every baby prior to discharge. But if they look yellow early on, then we'll be checking it sooner. And you can refer to the lesson on hyperbilirubinemia for that, just more information. Vitamin K. So this is that vitamin that's given by injection at delivery. And this is going to prevent any hemorrhagic issues for the baby because they're not born with enough vitamin K. All right, our renal system. So what's happening there? So in the renal system, we are going to be watching for voids, make sure the baby's peeing enough. So they should have 1 pee for every 24 hours old that they are. So we want to watch for that. Weight loss. All babies lose weight, but we don't want any more than 10% weight loss. This is where we might need to supplement, make sure the baby's staying hydrated. And then with circumcision for the renal system, we want to make sure that the baby voids after circumcision. Make sure all that plumbing is still working okay. Our integumentary system, we're going to be looking for any abnormalities there. So, you know, there's lots of different skin things that can happen, but any abnormalities with the skin, weird rashes, things like that. We want to check also with the umbilical cord. So remember, our umbilical cord is going to be clamped after delivery, and that clamp can be removed once that cord is dry. The cord should be kept dry, okay? Dry cord care so that it can fall off. And that should happen within 7 to 10 days after delivery. So just keep an eye on the cord. We want to watch for any oozing or foul smelling that can be a sign of infection. For our management, a few important things. So assessment needs to be systematically done. That way we don't miss anything. So a head to toe assessment, you know, go in order. It just helps keep everything so that we don't say, oh, I forgot to look at this and have to go back. So head to toe. We want to keep the newborn dry and warm with assessment to prevent cold stress. Pacify. So we can offer a pacifier for comfort for the baby if it's okay with the parents. But typically with this, It's highly recommended during circumcisions, with the hearing screens, any of the lab work, because we just want to comfort the baby and help soothe them, especially with a hearing screen. It's really hard to do a hearing screen if the baby's screaming nonstop. So if we can pacify and comfort them, then it should be done. And then heel warmer. So this is just a warm little pad that's put on the heel to help warm it. It'll make the blood draw better, just better for the baby and quicker. So better for everybody. So if there's a problem detected, then there's going to be more education for those parents. But just our basic education on this will be the things that we are doing. So what's the newborn screening? What are we looking for? So you just tell them, we are looking for some different metabolic disorders. It's sent to the state lab and the results will go to your pediatrician. That's really all that they need to worry about at this time. So that's being done. Our bilirubin. You're explaining that you're checking the bilirubin. It's checked as a standard prior to discharge. So if the baby's a little bit jaundiced, we need to check that level also. And then if it's elevated, we can encourage them to increase their feedings, because remember, it comes out in the stool. So the more they feed, the more they poop, then the lower the bilirubin will get. And voids. We want to be educating them to count those voids, right? We want to make sure the baby's hydrated. So we don't want to miss any pees that baby has. So we want 1 per 24 hours of life while we wait for that milk to come in is what we're watching for. And then cord care. We want to teach them dry cord care, a bath. It should be a sponge bath until the cord falls off. Once that cord's off, they can have that full immersion bath in the water. And it should fall off at 7 to 10 days. And we want to encourage them not to pull it, just to let it fall off. Sometimes that cord is going to be dangling at some point, where it just seems like it would be super easy just to pull it off and detach it, but they should be encouraged not to do that, okay? We really just want to let that fall off, even if it's hanging. Our concepts for this are going to be human development, because it is the body systems, clinical judgment, because we have to assess and make clinical judgments on what's found and properly intervene if needed, and then patient education, because we're going to be providing education on what we are doing and the different things that are found. All right, let's review our good key points to remember. So the body system assessments are a tool used to assess specific systems. The main ones are hearing screen, bilirubin for jaundice, newborn screening, which tests about 26 different metabolic disorders. And then using these screening tools are going to be essential just to help for early intervention and catch problems and treat properly. The newborn screening is important that it's done at 24 hours of life and not before that, because we need the baby to have several good feedings before we do a newborn screening, since we're looking at metabolic disorders, right? It makes sense, right? We need them to have good feedings in them to make sure that we can detect these metabolic screenings based on what they're eating. And then our bilirubin is done at discharge, or sooner if they are more yellow or there's other concerns. And then our hearing screen, usually done after 24 hours. It can be done sooner, but they could have more fluid in their ear that could cause them to refer or fail. Make sure you check out the resources that are attached to this lesson and review the different assessment tests that are done and when to do them. Now go out and be your best selves today. And as always, happy nursing.